Welcome to the Population Health Management Podcast, brought to you by Lightbeam Health Solutions. My name is Laurel Derr, and I will be your host for today's episode. So today we have Christine DiNoia, a registered nurse, here with us. She serves as an advisor on our clinical transformation team.
The topic today that she's going to be discussing with us is immunizations, as August is National Immunization Awareness Month. To start us off, I'd love to have Christine give us a little bit about herself. Kind of, if you could tell us who you are, what you do, what your role at Lightbeam is, that'd be great.
Great. Thanks, Laurel. I appreciate you having me here today. And just to give you a little background, I am, like you said, I'm a bachelor's prepared registered nurse, and I have been a nurse for several years, over 20 years, and been in the population health arena for approximately the last 10 years. And so my role here at Lightbeam is I help clients to optimize their care management programs and find the most efficient way to perform the activities that they need to, and as well as identify patient populations that would benefit most from care management and population health initiatives.
Awesome. Thank you. And I'm excited to learn more from your expertise during this podcast.
First, I kind of want to touch back on National Immunization Awareness Month. I know later in the podcast, we're going to get into COVID-19 vaccine, the importance of the flu and other immunizations that can be overlooked. Could you share a little bit just generally about National Immunization Awareness Month?
Yes, the goal of population health management, obviously, is to keep patient population as healthy as possible. And while we focus on the high-risk patients who seem to consume the majority of the healthcare costs, another component that we need to address is the preventive and chronic care needs of every patient. So one method would be to help prevent illness through vaccination. And vaccines are recognized as one of the 10 greatest public health achievements of the 20th century by the Centers for Disease Control and Prevention. And that's why this is so important and why we wanted to focus on this topic for the month of August, because vaccination can help reduce disease burden, disease transmission, and the need for disease-specific therapeutic intervention. So we wanted to touch upon not only the COVID-19 vaccine and the status of it, but also the importance of the flu vaccine, since that flu season's coming up, and other immunizations as well.
So I know a lot of us might not know fully about the vaccine creation process. I was wondering if you could share a little bit about the creation and the clinical trials for those of us who don't know.
Sure. So Food and Drug Administration, the FDA, and the CDC, the Centers for Disease Control and Prevention, work together and collaboratively have come up with guidelines so that we can safely get vaccines to the marketplace. So what they do is there's several different phases, and I think we hear about that a lot in the media, and you've heard about phase 1, phase 2, phase 3, and whether they're called the exploratory stage, the preclinical stages, and the clinical development. Basically, the phases are the beginning phases. They do go and test them on healthy volunteers in the first phases, around 20 to 100 people, to make sure that the vaccine's safe, whether it seems to work, and are there any serious side effects. The next phase, they will expand that to several hundred volunteers, and they look at the most common side effects and how the volunteers' immune system seem to be responding to the vaccine. And then in subsequent phases, phase 3 and on, they do look at hundreds or thousands of volunteers. And that's what we seem to be heading towards. There are several companies that are currently either in phase 3 of trials or about to enter into phase 3. So they will look at thousands of people who get the vaccine and who do not get the vaccine, and how do they compare? Is the vaccine safe, and are they effective, and what are the most common side effects? Again, once we pass those first 3 phases, what they'll do is they'll go ahead and get into the approval process, and as long as the FDA approves the vaccines, then they'll be made into what we call batches or lots. And then once they're all made into those lots, what they will have to do is manufacturers have to test all the different lots to make sure they're safe and pure, as well as potent. And then as time goes on, for quality control, they have to actually, the FDA inspects the manufacturing facilities regularly to make sure that they can ensure quality and safety of the vaccines.
So, Christine, how would you say the vaccines are monitored after they get approved and go through all those phase processes?
So just like the phase processes, there's also follow-up quality assurance. So the FDA and the CDC work collaboratively together, and there are a few different national surveillance programs available to monitor the safety. And so the largest one is called the Vaccine Adverse Event Reporting System, which is called the VERS system. And it's a national safety surveillance program that's co-sponsored by the FDA and the CDC. And it collects and analyzes information from reports of adverse events, such as side effects that occur after the administration of all U.S. licensed vaccines. And anybody can report. So it can come from individuals, patients, parents, healthcare providers, vaccine manufacturers, pharmacists. And also there are 2 other networks of healthcare organizations across the U.S. that monitor vaccine safety. And they're called the Vaccine Safety Data Link, the VSD, and the Post-Licensure Rapid Immunization Safety Monitoring, which is called PRISM. And along together, collaboratively, all of those programs can gather information so that we can ascertain and ensure the safety of these vaccines going forward.
So considering the phased approach you just mentioned, could you update us on where the COVID vaccine is in those different phases?
Sure. So it seems as though there are multiple companies that have either entered phase 3 or about to enter phase 3 for the COVID vaccine. And once we get through that final phase, the FDA will be able to approve the vaccine after phase 3 has been completed. And then they'll go into the manufacturing of the vaccines and make sure that the availability of them and supply and demand is available throughout the country. So with governmental support, the goal is to begin delivery of approximately 300 million doses of an FDA-authorized, safe, and effective vaccine for COVID-19 by the end of the year or early part of 2021.
I know myself, as well as everyone else, is hoping that all of this goes off without a hitch so we can get the vaccines out to everybody.
Absolutely. I agree 100%.
From your perspective, do you think COVID will affect the annual flu season and vaccine? And what are some additional things we should be considering?
Sure. I do think that COVID will complicate things for the upcoming flu season as we are getting closer here. So definitely things that we'll have to think about and have more planning this year than we normally do. Well, because we'll have to plan for certain clinics that may normally offer the flu vaccine might not be able to offer the flu vaccine this year due to social distancing guidelines and other health and safety initiatives that we have in place. So we'll have to definitely be doing more planning, more tracking of availability, and it will be even more important for providers to be able to provide flu vaccines at the point of care. So have those available and ready for their patients when patients come in for regular visits. Also, we'll have to think about the patients that are most at risk for COVID-19 are also going to be high risk for the flu. So we'll have not only one disease to worry about, but 2. So we'll really have to be paying close attention to those members of our patients that could be most affected by these diseases.
So then how would you recommend that we pinpoint these patients that need these immunizations and that are at a more high risk?
Sure. So I think that once the vaccines, once COVID vaccine is available, there'll probably be some sort of prioritization that goes on as far as because they won't be able to keep up with the supply and demand. And I'm sure that at first frontline healthcare workers and essential workers will be the first to get it. But then after that, it could get a little complicated. But I'm sure the CDC and the FDA will work together in making recommendations once it's approved. But as far as the flu season goes, you will have to think about the different types of vaccines that are available. So what we can do here at Lightbeam is focusing on these vaccinations, whether it's for COVID-19, flu, or any other disease. It's really about protecting the health of the most vulnerable members of our communities. And we could use quality improvement drivers, such as those quality measures, to identify groups of patients that have not received certain vaccines. And we can also identify those patients that are at higher risk by certain diagnosis codes. And we can provide rapid and real-time identification of those groups, or cohorts, if you will, of your patients. We could even utilize our analytics to be able to track areas either by location, by state or city locations that maybe be hotspots for not meeting those quality measures. So we could utilize that information, provide that information to you so that you could go out and provide community education in those areas of the population that have lower immunization rates and would benefit from additional education.
Yeah, I think it would be very beneficial, kind of working with the advisors that we have on our clinical transformation team to build out all of those processes. What would you say is some of the advice that you could offer to a care management team that's trying to build out one of these plans and target those specific high-risk groups?
I think that probably the best advice I could give is that we really have to do more planning this year, more so than ever, because we have to account for those that are socially distant or isolated based on what's going on with COVID. Also, we have to look at the geographical isolation and also pay attention to those that are just not general consumers of the healthcare system. So not only do we have to plan more so than we would any other year, but we also have to utilize our education. We're in a time where we have the ability to have technology at our fingertips. We need to be able to utilize that technology. And I think that education is key when it comes to all of the vaccine information that's out there. So we need to be able to distribute the information, whether it be for influenza, COVID-19, or any other vaccine that's available out there or that we're trying to meet the initiatives on. But we also want to make sure that we utilize a form that your organization supports in an easy to understand language. So whether that be a portal communication, handouts in the office, emails or text messages, or even using social media, making short videos and placing them on a provider website, releasing them to YouTube, whatever makes sense for your particular population or the population that you're looking at addressing. But we really want to pay attention to the health literacy of that population and which form or combination of forms of communication would best suit the needs of the particular population. So we need to also make sure, and another piece of advice that I would give is that providers make sure that the employees are up to date on their own recommended vaccinations, and also be able to provide education to the staff in the office to ensure that everyone's on the same page. Health workers remain the most trusted advisors and influencers of the vaccination decisions. And if we are able to educate the people within the offices, the capacity and the confidence of the healthcare workers will be able to respond to the questions and discuss the rare risks and the benefits of vaccination, which will only help to increase our vaccination rate.
So with that being said, what kind of measures do you anticipate will be put into place to administer these vaccines?
So, like I mentioned earlier, because of COVID, we're going to have to really overthink things this year. And so we're going to have to make sure that when you're thinking about creating your vaccination program, that you're going to have to promote appointment time to prevent overcrowding, really stick to those appointment measures, having people not waiting in waiting rooms, not having large vaccination clinics won't be as applicable this year because of COVID. But in addition to that, we'll also have to make sure that you're abiding by the best practices for storage and handling of vaccine, and as well as vaccine administration. So we'll have to make sure that everything's being stored appropriately at the right temperatures, handling of the vaccine should be limited due to the COVID pandemic, as well as documenting the information so that we can go forward, make sure that we have all of the information and it's in a reportable database. So whether we use state-based immunization information systems or electronic medical records, as well as client held paper immunization records, so that all of the providers have accurate and timely information on their patients' vaccination status.
Hearing all that you have today already, it was great hearing a little more about some topics that are affecting immunizations, National Immunization Awareness Month. I know this was pretty brief, but do you have anything else you want to add or share with our listeners today?
Sure, it was my pleasure. And I just wanted to wrap up by just saying that while this was brief, it's great to always talk about vaccines because they are such an important and make such an impact in our keeping our patients healthy. But let's be honest, there is some vaccine bias out there, but overall lack of information or misinformation can cause patients to delay or skip certain vaccines altogether, which can increase the disease burden on our society. So I'm hoping this has helped to clarify some of the vaccine information that's out there and to give some ideas how Lightbeam can help as COVID vaccine is released.
Great. Well, if some of our listeners were interested in getting more information, immunizations, and how to start care management programs to target the high-risk patients, where do you suggest that they go to find additional resources?
Well, sure, just general information about the COVID-19 vaccine or vaccinations in general. The CDC has great information and robust information about vaccine schedules, catch-up schedules, as well as emerging COVID-19 information. So I'd always recommend that people go to the CDC website for additional information, as well as the NIH and the FDA. Outside of that, if they needed help from Lightbeam, you can certainly reach out to us through our website, or also we'll include those links in the description part of this podcast.
Absolutely. Christine, appreciate you joining us today. You had a lot of great information. I just wanted to say thank you for coming on the Population Health Management Podcast.
Sure, my pleasure. Thanks so much.